The ranger's blood pooled faster than the surgeon's could move. His chest heaved. His eyes rolled back. Then his hand shot up, not reaching for help, but snapping into a salute. The room froze. Every doctor turned. He wasn't looking at them. He was looking at her, the quiet night nurse in the corner, the one they'd been ignoring for 6 months. His lips moved. One word. Lieutenant. Maya Heron moved through the trauma bay like water, silent, efficient, unnoticed. She restocked the intubation cart first, checked the laryngoscope batteries. Replaced the size 7 ET tubes they always burned through on Friday nights. Then the crash cart, epinephrine, atropine, amiodarone, all dated, all labeled, all in the correct sequence. She worked alone. She preferred it that way. The overhead lights hummed. The floor gleamed under her shoes. It was 200 hours, the quiet pocket between the late-night drunks and the early morning chest pains, the kind of silence that didn't last. Behind her, the residents clustered near the nurses' station. 3 of them, surgical interns, barely a year out of med school. They were talking about a case from earlier, botched IV line misdiagnosis. Attending chewed them out. One of them laughed too loud. The others checked their phones. None of them looked at her. Maya didn't mind. She finished the cart and moved to the supply closet. Restocked gauze packs, trauma shears, Israeli bandages. She counted each item twice. Muscle memory. 6 months in this hospital and she knew every drawer, every cabinet, every crash protocol by heart. But they still didn't know her name. Hey, nurse. Maya turned. One of the residents stood in the doorway, young, maybe 26. His badge said Dr. Voss. He'd been here 2 months. He'd never once made eye contact with her. We need a 16-gauge IV kit in Bay 3, he said. Patient's dehydrated, veins are shot. Maya nodded, pulled the kit from the shelf, handed it to him. He took it without a thank you, walked back toward the bay. She watched him go, watched him fumble the kit, drop the catheter on the floor, pick it up, use it anyway. She didn't correct him. Not her job, not anymore. Maya returned to the nurse's station and opened the monitor screen. 6 beds, 2 occupied, 1 MI ruled out, waiting on cardiology. 1 psych hold, waiting on security clearance. The rest were empty. She logged the supplies, updated the trauma board, checked the ambulance radio. Quiet. Behind her, the charge nurse Linda, 50-something, 20 years in the ER, sipped cold coffee and scrolled through her tablet. You're efficient, Linda said without looking up. Maya glanced at her. I mean it, Linda continued. You don't talk much, but you get it done. I like that. Maya nodded once. Thank you. You prior service? Maya hesitated just a beat. Medic. Army? Linda looked up then. Something shifted in her expression. Respect maybe, curiosity. How long? 8 years. Linda studied her. You don't talk like the other prior service nurses. They usually, let people know. Maya didn't respond. Linda shrugged, went back to her tablet. Well, you're solid. Don't let the surgeons push you around. Maya almost smiled, almost. The surgeons were a different species. Dr. Maida, Dr. Calling, Dr. Aranzo, all of them brilliant, all of them exhausted, all of them too used to being right. Maya had worked under their command for 6 months. She'd seen them save lives. She'd also seen them miss things, small things, critical things, a misread EKG, a delayed CT scan. A patient complaint dismissed as anxiety. She'd caught 3 of those mistakes, quietly, indirectly. She never said, you're wrong. She said, should we recheck the lactate, or do you want a second set of vitals? They never remembered it was her idea. That was fine. She wasn't here for recognition. At 3:20, the double doors opened. A stretcher rolled in, paramedics flanking it. A woman in her 60s clutching her chest, pale and sweating. Classic presentation. Chest pain radiating to the left arm, the lead paramedic said. Onset 30 minutes ago, aspirin given, vitals stable. Dr. Maida appeared from the break room, coffee in hand. He took one look and nodded. Bay 2, let's get an EKG and a troponin. The stretcher rolled past Maya. She watched the patient's face, watched her breathing, shallow, fast, eyes darting. Maya stepped closer. Ma'am, she said quietly, have you been short of breath today, even before the pain? The woman blinked, nodded. Yeah, since this morning. I thought it was just stress. Maya glanced at the monitor. Oxygen sat at 91%, not critical, but lower than it should be. She turned to Dr. Maida. Should we add a D-dimer, rule out PE? He paused. Looked at the patient, looked at Maya. Good call, he said. Then he walked into the bay, already forgetting who suggested it. Maya returned to her cart. Linda caught her eye from across the station. Gave her a small nod. Maya didn't react, she just kept moving. By 400, the ER had quieted again. Maya cleaned the trauma bay, wiped down the monitor stands, replaced the oxygen tubing. Straightened the supply drawers. The residents were gone. The attending had retreated to his office. Linda was charting. Maya stood in the center of the bay, alone, and looked at the empty bed. She'd stood in rooms like this 100 times before. Different uniforms, different continents, same weight. She exhaled slowly. Then she turned off the overhead light and walked back into the hall. The night stretched ahead, quiet, steady. She was invisible, and that was exactly how she wanted it. The call came in at 4:37. Maya heard it before the radio crackled, the distant chop of rotor blades, low and heavy, cutting through the pre-dawn silence. She was restocking the blood warmer when the dispatcher's voice broke through. Inbound medevac, ETA 4 minutes, male, late 20s, GSW to the chest, moderate blood loss, GCS fluctuating. Military transport, Ranger down. The station erupted. Linda shot to her feet. Trauma 1 now, full team, someone page Maida and calling. The residents scrambled. One knocked over a tablet. Another ran toward the supply closet, then stopped, confused about what he was supposed to grab. Maya didn't move yet. She listened. Ranger down, military transport. Her chest tightened. Just slightly, she pushed it down. She walked to Trauma 1 and began setting up. No hesitation, no wasted motion. Intubation kit, chest tube tray, rapid infuser, 2 units ONEG on standby. Scalpel, clamps, suction ready. She laid everything out in sequence the way she'd done it 1,000 times before. Linda appeared beside her. You've done this before. Maya didn't look up. Yes, ma'am, Army medic. Yes, ma'am. Linda studied her for a moment, then nodded. Stay close, they'll need you. The helicopter touched down at 4:41. Maya heard the landing gear hit the pad. Felt the vibration through the floor. 30 seconds later, the doors exploded open. 2 flight medics pushed the gurney through at a dead run. The patient was strapped down, cervical collar in place, pressure dressings soaked red across his chest. His face was pale, lips gray, his eyes were half open, unfocused. Gunshot wound, right upper chest, suspected pneumothorax, the lead medic called out. Entry wound only, no exit. He's had 2 liters saline, 1 unit blood, pressures dropping, 90/60. Heart rate 130, respiratory distress increasing. Dr. Maida and Dr. Calling swept into the room, gloves snapping on. Get him on the table now. The medics transferred him. The patient groaned. His hand twitched. Maya moved to his left side. She didn't wait for instructions. She cut away the remaining dressings, exposing the wound, high right chest, just below the clavicle. Entry wound, jagged about 9 millimeters, dark blood pulsing slowly. She glanced at his chest rise. Uneven, the right side lagging, pneumothorax, maybe worse. Dr. Maida leaned over the wound. Chest tube, we need to decompress now. One of the residents fumbled with the tray, dropped a clamp, swore under his breath. Maya handed Maida the scalpel without a word. He took it. Didn't look at her. She stepped back, watched his hands, watched the patient's face. The patient's eyes cracked open. He was younger than she'd thought, maybe 27. Jaw tight even through the pain. His dog tags hung against his bare chest, scratched, worn, stained. His breathing hitched. His lips moved. Maya leaned closer. Sir, she said quietly, stay still. We've got you. His eyes found hers, struggled to focus. He tried to speak. Nothing came out. Don't talk, Maya said. Save your strength. His hand lifted slightly, fingers trembling. Reaching for something, Maya caught his wrist gently, lowered it back to the table. You're safe. We're taking care of you. His eyes stayed on her, searching, then his head rolled to the side. His breathing turned shallow, pressures dropping, Linda called out. 80/50, Dr. Calling swore. He's bleeding into the chest cavity. We need to move faster. Maida made the incision. Inserted the tube, blood and air hissed out in a rush. The patient jerked, gasped, his back arched. Maya placed a hand on his shoulder. Firm, steady, you're okay, she said, low, calm. Breathe through it. He locked eyes with her again. This time something flickered, recognition maybe, or just desperation. Then his lids fluttered, his body went slack. He's crashing, Calling said. Start pressors, prep for intubation. The room became a storm, residents calling out numbers, Linda adjusting IV lines. Maida and Calling working in tandem, hands moving fast, voices clipped. Maya stayed at the patient's side. She monitored his airway, watched his oxygen levels, checked his pupil response. Her hands didn't shake, her voice didn't rise. She'd been here before. Different room, different war, same fight. One of the flight medics lingered near the door. He caught Maya's eye. Former military, she could tell, the way he stood, the way he watched. He gave her a small nod. She didn't return it. She turned back to the patient. At 4:54, they stabilized him, barely. Chest tube in, pressure rising, 95/62. Heart rate settling at 118. Dr. Maida stepped back, exhaling hard. Okay, he's holding for now. Dr. Calling pulled off his gloves. We need imaging. Full chest CT, and someone call the OR. We might need to crack him open if there's deeper damage. Linda nodded, started making calls. Maya remained beside the patient. She adjusted his oxygen mask. Checked the tube placement, watched his chest rise and fall. He was still unconscious, but stable for now. She looked down at his face, studied the lines around his eyes, the scars along his jawline. The calluses on his hands, she knew that look, she knew what it cost. Dr. Maida turned toward her. Good work tonight. Maya looked up. He met her eyes for the first time in weeks. You've got good instincts, stay sharp. Then he walked out. Maya stood there, alone with the patient. She pulled the blanket up over his chest, tucked it gently around his shoulders. You're going to make it, she said quietly. Just hold on. His fingers twitched, and for a split second, just a heartbeat, his hand moved. Not random, not a reflex. It lifted, slowly, precisely. And pressed flat against his chest. A salute, weak, barely formed, but unmistakable. Maya froze, her breath caught. She looked at his face. His eyes were still closed, his body still. But his hand stayed there, trembling, holding the position. Then it fell. Maya stared at him, her pulse hammered in her ears. She glanced toward the door. No one had seen it. She turned back to the patient, and for the first time in 6 months, she felt the weight of her old life pressing back in. Maya didn't leave his side. The CT scan came back clean, no major vascular damage, no shrapnel fragments lodged near the heart. The chest tube had done its job. His pressure was holding, oxygen saturation climbing back to 96%. Dr. Calling reviewed the images and nodded. He's stable enough to wait. OR's backed up anyway. We'll monitor him here for another hour, then move him upstairs. He left. The residents followed. Linda squeezed Maya's shoulder on her way out. You good here? Maya nodded. Call if anything changes. Yes, ma'am. The room emptied. It was just her and the ranger now. Maya stood at the foot of the bed and studied him. He was still unconscious, sedation keeping him under. His chest rose and fell in steady rhythm. The monitor beeped softly. Heart rate 102. Blood pressure 108/68. Better, but something wasn't right. She moved closer. His jaw was clenched, his eyelids twitching. REM sleep, but not rest. His fingers curled against the sheets. His breathing hitched every few seconds, like he was fighting something in his mind. Maya had seen it before. She pulled a stool close and sat down, kept her voice low. You're safe, she said. You're stateside, you're in a hospital, no one's shooting at you. His breathing didn't change. She tried again, slower, steadier. You're home, the fight's over. You did your job? His hand twitched. Maya watched it, watched the way his fingers moved, not random, deliberate, like he was reaching for something, a rifle grip. She knew that movement. She leaned forward closer to his ear. Stand down, Ranger, she said quietly. Mission complete. His eyes snapped open. He didn't move his head, didn't thrash. Just stared straight up at the ceiling, chest heaving, eyes wide and glassy. Maya stayed still, didn't touch him, didn't crowd him. You're okay, she said, calm, firm. You're in a hospital. Virginia, you were shot. We patched you up. You're stable. His eyes darted left, right, scanning, then they locked on her. He stared. Maya held his gaze, didn't look away, his lips parted. He tried to speak, his voice came out hoarse, barely a rasp. Where? Trauma Center, Level 2, you came in by medevac about an hour ago. He blinked, processed, his eyes didn't leave hers. How bad? Gunshot wound, upper right chest, pneumothorax. We decompressed it. You're stable, you'll need surgery, but you're going to make it. He exhaled slowly, his shoulders loosened. Just slightly, then his eyes narrowed. He was studying her now, not the room, not the equipment, her. You, his voice cracked, he swallowed, tried again. You were here. When I came in, yes, you told me to breathe. Maya nodded. He stared at her for a long moment, his brow furrowed. Something shifted in his expression, confusion, then recognition, then disbelief. His right hand moved, slow, shaking. He raised it off the bed, fingers trembling, and brought it to his forehead. A salute, weak, unsteady, but perfect. Lieutenant, he whispered. Maya's chest tightened. She didn't move, didn't react, just looked at him. His hand stayed up, waiting. She glanced toward the door, still empty, the hallway quiet. She turned back to him. And slowly, against every instinct that told her to stay invisible, she returned the salute. His eyes glistened. He lowered his hand, let it fall back to the bed. Heron, he said, voice stronger now. Lieutenant Maya Heron, 75th Med Company. Maya's jaw tightened. She hadn't heard that name in 2 years. You know me? She asked quietly. Kandahar, 2019. You pulled me out of a burning Humvee after an IED hit. You and your team kept me breathing for 40 minutes until the bird arrived. Maya searched his face, tried to place him. Kozlov, he said. Sergeant First Class Dmitry Kozlov, 2nd Battalion, 75th Ranger Regiment. It came back, a flash, smoke, fire, blood on her hands, a man screaming. Her voice cutting through the chaos. Stay with me, Sergeant. Eyes on me. She remembered. You made it, she said. Because of you. She shook her head. You made it because you fought. You gave me something to fight for. His voice was steady now, clear. You didn't leave, you didn't panic, you just held the line. Maya looked away. I tried to find you after, Kozlov continued. Put in a commendation, but you were already gone, redeployed. Then out, I finished my contract, and now you're here, now I'm here. He studied her. Why nursing? You were command level, you could have gone SOF pipeline, commissioned. You had the scores. Maya didn't answer right away. She looked at his chest, the bandages, the tube draining into the canister beside the bed. I was tired of war, she said finally. Kozlov nodded slowly. Yeah, I get that. Silence settled between them, not uncomfortable, just heavy. The door opened. Dr. Maida stepped in, chart in hand. He glanced at Maya, then at the patient. You're awake, Maida said. Good, how's your pain? 1 to 10. Kozlov looked at him. 6. We'll adjust your meds. I need to ask you some questions. She saved my life, Kozlov interrupted. Maida blinked. I'm sorry. Kozlov nodded toward Maya. Her, Lieutenant Heron, she saved my life twice now. Maida looked at Maya. Confusion flickered across his face. Lieutenant, Maya stood. He's confused. The sedation. I'm not confused, Kozlov said. His voice was firm, stronger. She was my medic, Kandahar, 2019. She's the reason I'm still breathing. Maida stared at her. Maya kept her face neutral. I was a combat medic, army, that's all. That's not all, Kozlov said. He looked at Maida. She led a medical detachment under fire. Saved 14 Rangers in 1 deployment. She should have gotten a bronze star, maybe a silver, but she turned it down. Maida's expression shifted. Something like respect, something like shock. Why didn't you say anything? He asked Maya. It wasn't relevant, she said. Not relevant. Maida looked at Kozlov, then back at her. You've been here 6 months. You've been working nights, restocking carts, taking orders from residents. That's my job, Maya said quietly. Maida opened his mouth, closed it. He didn't know what to say. Kozlov's monitor beeped. His heart rate was climbing, 115, 120. Maya moved instantly, checked his IV, his oxygen, his chest tube output. You're spiking, she said calmly. Breathe slow, in through your nose. Out through your mouth, Kozlov obeyed. His breathing steadied. His heart rate dropped back to 108. Maya adjusted his pillow, checked the restraints loose enough not to agitate him. Maida watched her. Silent, she worked like she was still in a field hospital, precise, instinctive, no hesitation. When she finished, she stepped back. Kozlov looked at her. "Thank you, LT." She met his eyes. Just for a moment, then she turned to Maida. "He's stable, but he needs rest. I'd recommend limiting visitors and keeping the lights low." Maida nodded slowly. "Yeah, okay." He lingered for a moment, then walked out. Maya started to follow. "Lieutenant." She stopped, turned back. Kozlov was looking at her, his eyes clear. "Grateful. You don't have to hide here," he said. Maya's throat tightened. She didn't respond, just gave him one small nod and walked out into the hallway. Linda was waiting by the nurse's station. She didn't say anything at first, just looked at Maya. Then she spoke. "Quietly, Lieutenant." Maya didn't stop walking. "It was a long time ago. That man in there thinks you're a hero. That man in there is medicated." Linda stepped in front of her, blocked her path. Maya stopped. Linda's expression was soft but serious. "Why are you here?" Linda asked. "Really?" Maya looked at her, and for the first time in 6 months she told the truth. "Because I wanted to save people without carrying a rifle." Linda held her gaze, then nodded. "Okay," she said quietly. She stepped aside. Maya walked past her, back toward the supply closet. Back to the shadows where she belonged. Maya was restocking gauze packs when the alarm went off. 6:12 hours, trauma 1. She dropped the box and ran, the hallway blurred. Her boots hit the tile in rhythm, fast, controlled. She heard voices before she reached the door, shouting, panic. She shoved through. The room was chaos. Kozlov was seizing. His back arched off the table, his arms rigid. The monitor screamed. Heart rate 168. Blood pressure plummeting. 70/45. Dr. Calling stood at the head of the bed, hands hovering, frozen. He was stable. What the hell happened? One of the residents was fumbling with a crash cart. Another was trying to push sedation through the IV. The line had blown. Blood leaked down Kozlov's arm. "Someone get that line back in now," Calling barked. Maya stepped to the bedside. She didn't ask permission. She grabbed Kozlov's wrist, checked his pulse. Thready, weak. His skin was cold, clammy. She looked at the monitor, oxygen saturation dropping, 89%, 86%. "He's in shock," Maya said. "I can see that," Calling snapped. "We need to stop." The room froze. Maya's voice cut through the noise, calm, absolute. She turned to Calling. "Stop pushing meds, stop moving him, listen to me." Calling stared at her. "Excuse me, there's a second wound." Silence. Calling blinked. "What?" Maya didn't repeat herself. She moved to Kozlov's right side and pulled back the blanket. The dressing over his chest wound was intact, clean, no fresh bleeding. She rolled him slightly onto his left side, and there it was, small, hidden under his right shoulder blade, partially obscured by the strap of the chest tube harness, an entry wound. Maybe 7 millimeters, dark, crusted over, but fresh blood was seeping from the edges. "Jesus," one of the residents whispered. Maya looked up at Calling. "It's been there the whole time." "It wasn't on the flight medic's report. We missed it." Calling's face went pale. "That's impossible. We did a full trauma survey. It was covered by the harness. And he was on his back the entire time. No one rolled him." Calling stared at the wound, then at Maya. "How deep?" he asked. Maya leaned closer, studied the angle, the trajectory. "At least 4 inches, downward entry, small caliber, likely fragmented. It's sitting near the subclavian artery." Calling swore under his breath. "If we intubate him now, the pressure shift could rupture it," Maya finished. "He'll bleed out in seconds." The room went silent. Kozlov's breathing hitched. His body went rigid again. The monitor shrieked, "Pressure's dropping," Linda called out from the monitor station. 60/40, he's crashing." Calling looked at Maya. "What do we do?" She didn't hesitate. "We stabilize the bleed manually, then we move him to the OR, no intubation until he's open." "That's insane," one of the residents said. "He won't make it to the OR without intubation. He won't make it with intubation," Maya said. She looked at Calling. "Trust me." Calling stared at her, then he nodded. "Do it." Maya moved. She snapped on fresh gloves, grabbed a pressure pack from the crash cart, tore it open. "Linda, get me a 14-gauge needle and a syringe. I need to drain the hematoma before we move him." Linda didn't question it. She grabbed the kit and handed it over. Maya positioned herself behind Kozlov. She palpated the wound. Felt the swelling beneath the skin, blood pooling in the surrounding tissue. She inserted the needle, drew back, dark blood filled the syringe. Got it, she said. Pressure's relieving. Kozlov's breathing eased just slightly. The monitor beeped, heart rate dropping, 142, 130. It's working, Linda said. Maya withdrew the needle and applied the pressure pack. Held it firm. We need to move him now, she said. Call the OR, tell them we're coming up. Gunshot wound, subclavian proximity, high risk of rupture. They need to be ready. Calling grabbed the phone, started barking orders. Maya kept pressure on the wound. She looked down at Kozlov. His eyes were half open now, glassy, unfocused. Stay with me, Sergeant, she said quietly. We're not done yet. His lips moved, barely a whisper. LT, I'm here, don't talk, just breathe. His hand twitched, reached toward her. She caught it. Held it. You're going to be fine, she said. I'm not letting you go. His fingers squeezed hers, weak but there. They moved him at 6:21. Maya stayed at his side. One hand holding pressure on the wound, the other steadying the gurney. They rolled through the hallway. Linda led the way, clearing the path. Calling followed, still on the phone with the OR. The residents trailed behind, silent now. Maya didn't look at them. She kept her eyes on Kozlov, on his chest, his breathing, his pulse. Every second mattered. They hit the elevator. The doors closed. It was just Maya, Linda, and Kozlov now. The elevator hummed. Linda looked at Maya. You've done this before. Maya didn't answer. How many times? Linda asked. Maya kept her eyes on Kozlov. Enough. The elevator stopped. 5th floor, surgical wing. The doors opened. 2 OR nurses were waiting, gowned, gloved, ready. Bay 2, one of them said. Doctor Iranzo's scrubbing in now. They moved fast, down the hall, through the double doors. The OR was bright, cold, sterile. They transferred Kozlov onto the surgical table. Maya kept pressure the entire time, didn't let go until the OR nurse's hands replaced hers. We've got him, the nurse said. Maya stepped back. Her hands were shaking, just slightly. She clenched them into fists. Dr. Iranzo entered, older, 50s, former Navy surgeon. He'd seen combat. You could tell by the way he moved. He looked at the wound, then at Maya. You found this? Yes, sir. Anyone else see it? No, sir. He studied her. You prior service? Yes, sir. Combat medic, 8 years. Iranzo nodded slowly. You just saved his life. Maya didn't respond. Iranzo turned to his team. Let's open him up, careful around the subclavian. If that vessel's nicked, we've got maybe 2 minutes. The team moved into position. Maya started to leave. Stay. She stopped, turned back. Iranzo was looking at her. You found it. You stabilized him. You should see it through. Maya hesitated. Scrub in, Iranzo said. I might need you. She looked at Linda. Linda nodded. Maya walked to the scrub station. She washed her hands. Slowly, methodically, the water ran red for a moment, then clear. She dried off, gowned up, gloved, and stepped back into the OR. The surgery took 3 hours. Iranzo worked with precision. No wasted movement, no hesitation. Maya assisted, handed instruments, suctioned blood, monitored vitals. The bullet had fragmented, 2 pieces lodged near the subclavian artery. One had nicked the vessel wall, not a full rupture, but close. Iranzo repaired it, sutured the artery, removed the fragments. The entire time he asked Maya questions. How did you spot the wound? He was seizing. Vitals didn't match the injury pattern. I checked for secondary trauma. Most nurses wouldn't think to do that. Most nurses weren't trained in forward operating bases. Iranzo glanced at her. Where'd you serve? Kandahar, Helmand. Mosul, he nodded. You saw heavy action. Yes, sir. And you walked away from it. Maya didn't answer. Iranzo didn't push. He finished the final suture, stepped back. He's stable, he said. Close him up. The team moved in. Maya stepped aside. Iranzo pulled off his gloves, looked at her. You should be teaching, he said, not restocking carts. Maya met his eyes. I like restocking carts. Iranzo studied her for a long moment, then he nodded. Fair enough. He walked out. Maya stayed until Kozlov was closed, until his vitals were stable. Until he was moved to recovery, then she left. She walked back down to the ER, stripped off the gown, washed her hands again. Her shift had ended 20 minutes ago, but she didn't leave. She went back to Trauma 1, cleaned the room, restocked the supplies, wiped down the monitors. Linda found her there. "You should go home," Linda said. "I'm almost done." Linda watched her for a moment, then walked over and took the cleaning rag from her hands. "Maya, go home." Maya looked at her. "He's going to be okay," Linda said gently. "You saved him twice, you can rest now." Maya's jaw tightened. She nodded, grabbed her coat, and walked out into the early morning light. Maya didn't go home. She sat in her car in the parking lot and watched the sun rise over the hospital. The sky bled orange and pink. The world woke up around her. She stayed still. Her hands rested on the steering wheel. They'd stopped shaking an hour ago. She closed her eyes, saw the wound, the blood, Kozlov's face, the way his hand had reached for hers. She exhaled slowly. Then she started the engine and drove. She returned at 1900 hours, night shift, same as always. She changed into her scrubs in the locker room, pulled her hair back, clipped her badge to her collar. In the mirror, she looked the same. Nobody would know. She walked into the ER. Linda was already at the nurse's station. She looked up when Maya approached. "You came back," Linda said. "It's my shift." Linda studied her. "You didn't have to. I could have covered." "I'm here." Linda nodded slowly. She didn't argue. "Kozlov's stable," she said. "Post-op went well. He's in the ICU, awake, asking for you." Maya paused. "I'll check on him later." "Maya, I need to restock the trauma bays first." Linda watched her walk away, didn't stop her. Maya worked through the evening in silence. She restocked carts, prepped IVs, checked the crash equipment. The ER was quiet. A few minor cases, nothing critical. The residents didn't look at her differently. The attending didn't ask questions. It was like nothing had changed, exactly how she wanted it. At 21:40 hours, two men walked into the ER. They didn't check in at the desk, didn't speak to the triage nurse. They just walked straight toward the nurse's station. Maya saw them from across the room, both in their 40s, dark suits, no badges visible. But the way they moved, controlled, aware, scanning, told her everything. Federal. Linda noticed them too. She stood. "Can I help you?" The taller one spoke. "We're looking for Maya Heron." Linda's eyes flicked to Maya. Maya set down the supply tray and walked over. "I'm Heron." The man studied her. "We need a moment, private." Maya glanced at Linda, then nodded. She led them down the hall, away from the main floor, into an empty stairwell. The door closed behind them. The two men faced her. The tall one spoke first. "I'm Agent Dalton." "This is Agent Riscato. We're with the Defense Intelligence Agency." Maya kept her face neutral. "What's this about?" "Sergeant First Class Dmitry Kozlov," Dalton said. "You treated him last night." "Yes. You found a secondary wound that wasn't documented by the flight medics. You prevented a catastrophic bleed. You saved his life." Maya didn't respond. Riscato stepped forward. "Kozlov was part of a classified operation. The details aren't important. What's important is that he's alive because of you." "I was doing my job," Maya said. "Your job ended when you left the army," Dalton said, "but you didn't stop. You kept going." Maya's jaw tightened. "Is there a point to this?" Dalton exchanged a glance with Riscato. Then he reached into his jacket and pulled out a thin folder, handed it to her. Maya took it, opened it. Inside was a photograph. Kozlov in uniform, standing with his unit. Beneath it, a handwritten note. "Lieutenant Heron, thank you for pulling me out of hell. Twice, I owe you everything." "Kozlov." Maya stared at it, her throat tightened. She closed the folder. "Handed it back." "He's awake," Dalton said. "Stable, asking for you." "I know, you haven't visited." Maya looked at him. "I don't need recognition." Dalton studied her. "He doesn't want to recognize you, he wants to thank you." Maya didn't answer. Riscato spoke, quieter. "We read your file, Lieutenant. Kandahar, Helmand, 14 saves under fire. Multiple commendations declined. You walked away clean. No one knows who you were." "That's how I want it," Maya said. "Why?" Dalton asked. Maya looked at him. Her voice was steady, cold. "Because I didn't want to be a war hero. I wanted to be a nurse." Silence. Dalton nodded slowly. "Understood." He stepped back, gestured to the door. "Kozlov's in ICU, room 3. If you change your mind." Maya didn't move. The two men walked past her, opened the door, then Dalton paused, looked back. "For what it's worth, Lieutenant, you're exactly the kind of person we need more of, in uniform or out." He left. The door closed. Maya stood alone in the stairwell. She looked down at her hands. They were steady now. At 2:30 hours, Maya finished her rounds. The ER was quiet. Linda had gone on break. The residents were in the lounge. Maya stood at the nurse's station and stared at the computer screen. ICU access log. Room 3. Kozlov, Dmitry, SFC, stable. Her finger hovered over the keyboard. She could go up, check his vitals. Make sure the post-op care was adequate. It would be professional, expected. She closed the screen, turned away. At 3:40, the elevator doors opened on the 5th floor. Maya stepped out. She hadn't planned to come, but her feet had carried her here anyway. She walked down the hall, past the nurse's station. The night shift ICU nurse glanced up, recognized her, and nodded. Maya stopped outside room 3. The door was cracked open. The lights inside were dim. She hesitated, then pushed the door open. Kozlov was awake. He lay propped up in bed, IV lines running into both arms, chest bandaged, oxygen cannula in his nose, but his eyes were clear. He saw her immediately. "LT," he said. His voice was rough, but strong. Maya stepped inside, let the door close behind her. "You should be sleeping," she said. "Hard to sleep when you're alive because someone refused to let you die." Maya walked to the foot of the bed. Kept her distance. "The surgeons did the work," she said. "The surgeons would have intubated me and blown my artery if you hadn't stopped them." Maya didn't argue. Kozlov watched her. "Why didn't you come sooner?" "I was working." "Bullshit." Maya looked at him. He didn't flinch. "You didn't want the attention." She didn't answer. "You never did," Kozlov continued. "Even in Kandahar. You pulled me out of that Humvee, kept me breathing for 40 minutes, and when they tried to put you in for a commendation, you told them to give it to your team instead. They deserved it. So did you." Maya's jaw tightened. "I don't need medals. I know. That's why you're the best medic I ever served with." Silence settled between them. Kozlov shifted slightly, winced. Maya moved without thinking, adjusted his pillow. Checked his IV flow. Her hands worked on autopilot. "You're still taking care of people," Kozlov said quietly. "That's the job." "No," he looked at her. "That's who you are." Maya stopped. Met his eyes. "You didn't leave the army because you were tired of war," Kozlov said. "You left because you were tired of losing people." Maya's breath caught. She looked away. "I lost 12, she said quietly. 12 people I couldn't save out of hundreds. 12. That's a better record than most. It wasn't good enough." Kozlov shook his head. "You can't save everyone, LT, you know that. Knowing it doesn't make it easier." "No, it doesn't." Silence again. Maya pulled her hands back, stepped away from the bed. "You should rest," she said. "Wait." She stopped. Kozlov looked at her. His expression was serious now, grateful. "Thank you," he said, "for everything then and now." Maya held his gaze, then she nodded once. "You're welcome, Sergeant." She turned to leave. "LT." She looked back. Kozlov's hand lifted, slowly, carefully, a salute, crisp, steady, full of respect. Maya stared at him. Then, against every instinct, she returned it, held it for 3 seconds, and dropped her hand. "Heal up, Kozlov," she said. "Yes, ma'am." She walked out. Maya didn't go back to the ER. She walked to the stairwell, sat on the steps, leaned her head back against the wall, and for the first time in 2 years, she let herself feel it. The weight, the grief, the pride. The cost of saving lives. She sat there for 10 minutes, then she stood, straightened her scrubs, and went back to work. By 600, her shift was over. Linda found her in the supply closet, organizing the last of the IV kits. "You're off the clock," Linda said, "just finishing up." Linda leaned against the doorframe. "Kozlov's being transferred to Walter Reed tomorrow, full recovery expected." Maya nodded, kept organizing. "The attending wants to talk to you," Linda continued, "about a position in the trauma unit." "Lead nurse, day shift." Maya paused. "I'm fine where I am." "Maya, I'm fine where I am," she repeated. Linda sighed, but she didn't argue. She watched Maya for a moment, then spoke quietly. "You don't have to hide, you know." Maya looked at her. "You're allowed to be proud of what you did," Linda said, "both in the army and here." Maya's throat tightened. She turned back to the supplies. "I didn't do it for pride. I know, that's why it matters." Linda pushed off the doorframe, started to leave, then stopped. "For what it's worth, I'm glad you're here." Maya didn't respond. But she heard it, and somewhere deep down she was glad too. Maya walked out into the parking lot. The morning was cold, the sky clear. She got into her car, sat for a moment. Then she pulled out her phone, opened her messages. There was one new text from an unknown number. "You saved my life twice, LT. If you ever need anything, you call me. Kozlov." Maya stared at it, then she typed a reply, "Just keep healing, Sergeant, that's all I need." She hit send, put the phone away, and drove home. That night she returned for her shift. Same locker room. Same scrubs, same badge. She walked into the ER. The residents were clustered near the station. One of them looked up. "Hey nurse." Maya turned. He held up a chart. "We've got a multi-trauma coming in. Can you prep trauma 1? Maya nodded. "Yes, sir." She walked past him, into the trauma bay, opened the supply cart, and began to prep, quietly, efficiently. Invisible, exactly how she wanted it.